I chose to go in orthopedic surgery really because I love fixing that problem. I love when a patient comes into the office, has knee arthritis, hip arthritis, and then I can offer them a solution. And here at WVU, we have the tools and the skills to provide solutions to some patients that have been told there's no other options for them anywhere else. And so we're in a very unique position where we can solve some really complex problems and offer hope to patients that otherwise might not have some. What makes my day is when a patient comes into the office after a surgery and when they tell me that they're starting to get back to the things that they really want to do, whether it's playing with their grandkids, whether it's getting out in the yard, riding their bike, or going back to skiing. That really fills my cup. We try and go the extra mile for all of our patients. There was one patient that was unfortunately stuck in the hospital through the holidays, Thanksgiving and Christmas, and they had decorated their room. And I have 3 boys and brought my 3 boys in to visit the patient just prior to Christmas. And it was great to just see the patient's face light up, and they were so happy because they always asked how the boys were doing. Outside of work, I try and stay busy. I have a saint of a wife who keeps us all organized, and we probably test her sanity on a regular basis. We love to watch movies together. We love to go outside, play with the dog, and just kind of enjoy the area. All the boys are engaged in sports, and so obviously that consumes a lot of our time. And so really finding quality time to spend with them is what I enjoy the most. Some people find research boring. I find it really engaging. It excites me in terms of trying to answer those unanswered questions for us as surgeons and then for our patients as well. Because if we're not looking at how we can solve problems, how we can improve patient care, we're going to be destined to continue to do the same things over and over again and not make some of the great advancements that we've seen in the last 20 years in orthopedic patients, where we're able to get them up, get them moving the same day of surgery. 30 to 40% of our patients go home the same day. The team at the Center for Joint Replacement is excellent. We have 5 fellowship-trained surgeons that are all experiencing the most advanced techniques for hip and knee replacement. And what's great is in this team environment, we can share insights, comments, and gives us a sounding board where if we run into a challenging case, that we can discuss it. And then all of a sudden you have 5 world experts providing insight on your case. And I think that's just a great environment. It also allows us to continue to develop our program so that we can provide the most cutting edge techniques to our patients in the safest way possible.